Considering fillers for under eye bags. In my late 30s and starting to see signs of dark under eye bags. End of December 2016, I sought professional help and the doctor recommended Ultherapy to fix this issue. 3 months later, and this is my result. I am very disappointed and feeling as though I was tricked into a treatment that wasn't right for me. Would fillers be the way to go to remove my bags without going under the knife?
Thank you for your question. You submitted a single photo and you stated in your question that you're in your late 30s and that you've had an issue with struggling with under eye bags and dark circles, and that at a certain point you had a therapy performed for this concern of yours, and you feel like that didn't work out very well at all. And so you're asking, will fillers help you with this problem without you going under the knife, as you stated? Well, I can certainly help you with how I approach patients with similar issues in my practice, which I deal with pretty much every day. A little bit of background: I'm a board-certified cosmetic surgeon, fellowship-trained oculofacial, plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and helping people with their under eye bags and the challenges of these issues is something we do every day, all day long in my practice. So I can certainly understand your frustration, and we see this all the time. I think that in many ways the many advances of the instruments and methods we have to help people look their best has come with it a lot of confusion and a fair amount of frustration, as similar to the experience you've had. I think it's important to really first understand the anatomy. It always comes back to basically understanding anatomy. The anatomy of your problem right now of the under eye bags is something called lower eyelid fat prolapse. Lower eyelid fat prolapse means the fat that's normally around your eyes pushes forward, creates this bulge, often referred to as herniated fat. Now, it is something that, thanks to newer methods, whether it's a thermal energy device or injectables, there are ways to basically camouflage this area. But when you think about the anatomy, the fat is significant enough in volume that it's pushed forward. So it's understandable why a thermal energy device did not accomplish what you wanted, because it is very difficult for the skin to really tighten adequately enough. Now, with thermal energy devices, you can reduce fat, but it generally doesn't work that well when it comes to the under eye area, and it is basically a limitation. And the frustrations with thermal energy devices to deliver, whether implied or intentionally stated, the same results as surgery, invariably results in this level of frustration. And it's not specifically to the device that was yours, but I think a lot of people are just so afraid of surgery, they try so many different things and end up spending a lot of money and wasting a lot of time. So the question is whether or not fillers will help you avoid going under the knife. Well, let's put it this way: if a certain amount of puffiness is below a certain threshold, then anatomically a filler can maybe camouflage that area. And what does that mean? Well, when you look at the bulge of fat, think of it as a mountain. And when you look at the hollow next to it, the tear trough area, the under eye area, the rim of the bone structure, well, then that area potentially can be filled up to a point with a hyaluronic acid filler, such as Restylane. Now, it won't definitively treat the underlying problem, but it might camouflage enough for you to feel comfortable. Now, to help people like yourself put things in perspective with the under the knife fear, I explain to my patients that essentially anytime you enter the skin, it is an invasive procedure. And I do a lot of fillers for under eye bags. So it's not like I'm against it, but I have to do it selectively. So when you enter the skin, you can potentially have swelling, bruising, and irregularities. So it's not exactly a perfect solution, but it can be a way to help buy you some time. In our practice, when we deal with people who have puffiness like yours, who are ready to do a more definitive procedure, I typically would do something called a transconjunctival blepharoplasty. This is something that we do in our practice under local anesthesia. This way, patients are not afraid of going under general, which is one of the greatest objections to having surgery. It's done from the inside of the eyelid. It's basically, there's no external incisional scar. And it's done with a little bit of sedation, so people are relaxed. And it's done within an office setting, so this way the fear of going to a hospital or surgery center is eliminated altogether. So in a way, I've been very successful in trying to make this process, whether it's an injectable or a surgical procedure, as close as we can make them and still adhere to very high standards of safety and process. We're certified by the Joint Commission, same entity that certifies hospitals, surgery centers. So I think that it's very important for you to find a doctor who can give you honest guidance. I think that's one of the frustrations. When people bounce around and they respond to different enticements, they will often be frustrated because the people offering these different enticements are really looking for a transaction rather than a long-term relationship. And I think that's very, very important. And so find a doctor that you feel you can work with for not just a procedure, but for the years to come. I always say that I'm besides being a surgeon and doing all these procedures, I'm like a primary care doctor for beauty. And I think that's a very good relationship to have. And that way a doctor who you feel comfortable with will guide you through these interesting waters as new ideas, technologies, injectables, lasers, and other things keep popping up, and everybody keeps running like a herd in these directions. So I hope that was helpful. I wish you the best of luck. Thank you for your question.